Hi everybody, my name is Dr. Jennifer Aaberg and I'm a dentist over at Park West Dental in Channing Way. And I've been doing a video series celebrating my 3rd year anniversary since joining this amazing practice. In this video series, I've been offering some small raffle prize giveaways. Those prizes are related to some of my favorite hobbies outside of being a dentist, as well as offering a new patient special. So if you are in need of a new dentist or a new exam or a new electronic toothbrush, if you call our office and schedule a new patient exam with us, you'll receive a free Oral-B electronic toothbrush. It's my favorite brand of electronic toothbrush. I just love the size and shape of this head. It's really able to get into the nooks and crannies, and it really makes my teeth feel clean. So give us a call. It's 208-522-1164 if you're interested in this special. And if you're one of our amazing existing patients, you are also eligible to receive a free electronic toothbrush if you refer a friend or family member who makes a new patient exam over at our office. So don't be afraid to give us a call on that. I've also been offering some small raffle prizes related to my hobbies, and anyone who knows me knows that I am an avid elk hunter. I've been hunting elk since I was about 11 years old, and so every September I'll be chasing elk with a bow in my hand, and you are not an elk hunter if you don't have an elk call in your pocket. So this video's prize is the Rocky Mountain Elk Call set. It's my favorite brand of elk calls. So if you like, share, or comment this video, or if you know and love us and give us a 5-star review, you can be entered into the raffle for these elk calls. And if you want to check out our other prizes, check out our Facebook page for the other videos. Some of the prizes is free bowling or a fly box. So don't be afraid to check that out. I've also been talking about some fun facts about dentistry, and today I wanted to talk about the stages of a cavity and how that affects when we decide to treatment plan fillings or not. The stages of a cavity is dependent on where it's located on the tooth. The tooth has 3 main layers. The most outside layer is the rock hard enamel. It's the white tooth structure that makes our teeth look nice and white. And it's the bone hard one. And then the inner layer, the second layer, is the dentin. It's a softer, more organic material. And then in the center of it all is the pulp chamber where the nerve and blood vessels lie. And so the stages of a cavity always go from the outside and in. So when you're starting to form a cavity, the acid from our diet or from the sugar that turns into acid will knock the calcium off the tooth structure of the enamel and start making it a little bit weaker, and we can see that change and that lack of calcium in the x-rays, and it kind of looks like this. So that's called decalcification, incipient decalcification, and this is not the time I will ever plan on treating a filling for you, because there are ways to treat this without fillings, including a change in oral hygiene habits as well as diets. And if we're able to stop the damaging process of this tooth structure, your tooth can actually remineralize, and this spot can stay like that forever as long as we keep it clean and keep those habits in place. When we leave it like this and we are able to conservatively stop it, it'll just leave a little scar like this, and it'll never continue to grow. But if we don't catch it on time, or if we have some bad habits, that decalcification will continue to grow so deep that there's actually no longer a face of the tooth. There's actually a hole in the side of a tooth, or a cave in the tooth, hence the name cavity. And we know that the tooth structure is too weak to be supported and turn into a cavity when the decalcification has reached the line in which the enamel and dentin meet, called the DEJ. And so when I start considering fillings is when I can actually see the damage into the dentin, because at this point I know no changes in our oral hygiene, no changes in our diet will prevent this from continuing to grow, because now there's actually a hole in the side of our tooth or on the top of our tooth, and it'll just continue to filter and feed in through, and it will continue to blossom and grow into that dentin. And if left untreated, it will get so large that you can actually break a tooth because it's so fragile and there's nothing supporting it underneath, or it gets so deep that it actually aggravates the nerve on the inside, causes inflammation, and can lead to expensive therapy like root canals. And so I take treatment planning a filling very serious, because a filling is a lifelong commitment. So I want to make sure that the filling is doing less damage to the tooth than leaving that tooth untreated. So at this point here, leaving a tooth untreated and addressing your hygiene and your diet is far better than a filling. But at this point, I'm afraid that if you were to do a filling now, or if you're not to do a filling now, it will grow into this eventually. How long it will take, I can't answer, but it will continue to grow. So it's when I see physical damage to the dentin in your x-ray, that's when I start recommending fillings, because I truly believe that filling is more conservative than letting it go unaddressed and causing more expensive therapy. But I will never plan for filling at this stage, because a filling is a lifelong commitment. Once you place a filling onto a tooth, you have what's called a margin, and that's where food and bacteria can kind of accumulate. So here's the shape of the filling that we place, and right here where the tooth, the filling will meet healthy tooth structure on the top and bottom, it's called a margin. And that's very difficult to keep clean. And so you want to do the filling and you want to keep it clean, because it will still continue to grow into this if you don't do the filling. But I'd much rather have this kind of situation than this situation, and I'd rather have this situation than this situation. So I like to be very conservative when I'm treatment planning fillings, but I also like to be conservative in treatment planning fillings when it's necessary, like situations like this. If you have any questions about cavities or broken teeth or root canals, don't be afraid to give us a call. It's 208-522-1164. I'm so passionate about teeth, and I just love talking and educating about that. So I'd love to meet you and get to know you, answer all your questions, and take care of you. Hope you have a wonderful evening. Check out our other Facebook videos. Take care.